Hello, welcome to Chapter 11, Special Senses. We're going to talk about the eyes and the ears today. So we're going to work on different words that pertain to the eyes and the ears and how they all work and function. So let's start with the eyes. Our eyes allow us to take in what is happening around us. Our eyes have many different accessory structures, such as eyelashes, eyebrows, eyelids, upper and lower, as well as the actual eye. We have the pupil, the conjunctiva, our eyelids help protect. Eyebrows work to keep sweat from running into the eye and to function in nonverbal communication. Eyelashes help to keep debris out of your eye. So let's make these words plural, because these are words that don't necessarily mean what they're supposed to. So orb, duct, and orbit are made plural very simply, adding an S. Canthus becomes canthi. This is the one that is different that you need to memorize because that one is different from the rest. So conjunctiva. Conjunctiva. Conjunctiva is the inner lining of the eyelids. If we add that itis at the end, conjunctivitis, means inflammation of that inner eyelid, also known as pink eye. Lacrimal. Look, lacrum means tear. All means that pertaining to. So pertaining to those tears, the lacrimal pertains to those tears, and that lacrimal apparatus, which is that tear producing apparatus in the above the eye. Nasolacrimal duct. So we have naso, that first combining form for nose. Duct means to lead. So that nasolacrimal duct is that passage from the lacrimal sac to the nose. Tears clean and lubricate the surface of your eye. There's constantly this lacrimal fluid being secreted onto your eyeball to help keep your eye lubricated. It delivers nutrients and oxygen to that conjunctiva, and it prevents infection through bactericidal enzymes. Ophthalmologist. So, ophthalmo means eye. Logist is someone who studies or specializes. So, an ophthalmologist is a medical specialist who specializes in treating disorders of the eye. Periorbital. Peri is my prefix. Orbit means orbit. All means pertaining to. So periorbital means pertaining to the tissues around the eye. Structures that are periorbital to the face are the eyebrows and the cheek. Photophobia. Photo means light. Phobe means fear. IA means condition. So photophobia is somebody who has a fear of light because it causes pain in the eyes. So conjunctivitis is most often caused by viral, not bacterial bacterial contaminants. Different environmental factors that can cause conjunctivitis: chlorine in the swimming pool, soaps, fumes, smoke. There's also eyelid edema, which is that swelling of the eyelids that is often caused by allergens like pet dander, pollen, and dust. Blepharitis. And that itis is that inflammation. And then that blephar means eyelid. So blepharitis is inflammation of the eyelid. That ptosis means drooping. So blepharo again is that eyelid. So drooping of the eyelid, blepharoptosis. Blepharoplasty. Plasty means repair surgically. So blepharoplasty is that surgical procedure performed to remove excess skin from sagging eyelids. Humans, with their two eyes working closely together, have developed very good three-dimensional perception. Stereopsis, and hand-eye coordination. Stereosis depends on an accurate alignment of two eyes. When there is muscle imbalance in one eye, the alignment breaks down, and the resulting condition is called a strabismus. Most people know it in lay terms as cross-eyed. Esotropia is a condition in which the eye is turned inward towards the nose. We have congenital and accommodative esotropia. Congenital is when both eyes look towards the nose, and it is present at birth, because remember, congenital always means it's present at birth. This is going to require a surgery to correct it, while accommodative estropia is an inward eye turn that usually develops around 2 years of age and is treated with glasses, and perhaps an eye patch over that stronger eye. Exotropia. So, exo, that means outward. So exotropia is an outward turning eye. Amblyopia, that term literally means dull sight. It is a failure or incomplete development of the pathway or vision to the brain. So it's kind of known as a lazy eye. Amblyopia is treated with an eye patch over the stronger eye to develop the vision of the weaker eye. So esotropia is that inward turning of the eye, because that eso means inward, while that exotropia is that outward turning of the eye, because that exo is going to mean that outward, and that trope is going to mean, turn, and that IA is that condition. Ophthalmologist and an optometrist. Ophthalmologist is a medical doctor who can treat eye disorders and prescribe medication, while that optometrist is someone skilled in measuring vision of the eye and with the prescription of lenses. Extrinsic is Latin for outer side, and intrinsic is Latin for inner side. So let's look at the eyeball and seeing. So let's look at the different parts of the eyeball here. So our eyeball we have the cornea. This is this clear outer portion in the front of the eye. We have the iris. This is the colored portion of the eye. The pupil, which is this opening in that iris in the middle, that black portion. And what that is it's an opening into the back of the eye. Behind this iris, we have a lens. This lens is to help focus whatever image you may be looking at to the back of your eye. Now we have 3 layers of the eye. We have the sclera, which is the whites of the eye. And then we don't go through the middle layer. The retina is the innermost layer, and this is the layer that contains rods and cone receptors that receive an image for the brain to interpret. Plural, or pupil, in its plural form is pupillae. An adjective form of pupil is pupillary. Okay, so the structures in order from outside of the eyeball to the innermost portion. So we have the pupil, the retina, the lens, and the iris. So from outermost, that cornea is the very first one. Then we go to the iris, the pupil, the lens, and then the retina is that back portion of the eye. The retina is about the size of a postage stamp and is the final destination of light rays. When nerve transmits the signals from the retina to the brain, it's sending these signals on the optic nerve. Rods and cones are what help to pick up different vision or different colors, different whatever you're looking at. Rods or that dim light. It's what you can see at night. They make up these photoreceptor cells. Cones are for color. I always think cones have that C for color in them. They're going to pick up bright lights and color. They're going to differentiate between specifically red, blue, and green. Any other colors you see are a combination of those 3 colors, which uses a combination of those different cones, a red cone, blue cone, green cone. Color blindness is a hereditary lack of one of those 3 cones in that retina. Red-green color blindness is the most common, and it's where they're either missing the red cones or the green cones. So the eyeball is divided into 2 fluid-filled cavities. We have an anterior and a posterior. In the anterior chamber or cavity, we have aqueous fluid. Aqueous fluid removes waste products from the eye and maintains the internal chemical environment of the eye. In the posterior portion, we have vitreous humor. This is more of a jelly-like substance that is present at birth, and it stays the same your entire life. And it helps to maintain the shape of the eyeball. I'm going to use this picture for the next slide for a minute. The macula luda and the fovea centralis. So here, this macula luda is usually this whole area through here, while this fovea centralis is this little thing in the middle. The macula luda is a small kind of yellowish spot in the back of the retina that contains that fovea centralis in the middle. Macula is Latin for small spot. Luda means yellow in Latin. Fovea centralis is a pit in the center of that macula luda that has the highest visual acuity. It has about 4,000 cones. There's only cones found in the fovea centralis, no rods. And each cone has its own nerve fiber. Fovea means pit in Latin, and central means center, means pertaining to. So if you ever catch yourself tilting your head when you're trying to look at something, what you're doing is trying to focus an object into that fovea centralis so you can see it better. Visual acuity is the sharpness and cleanness of an image. Without a healthy macula luda and fovea centralis, you would not be able to see objects clearly with distinction. Acuity is Latin for sharpen. So light rays that hit the center of your cornea, this outer layer here, pass straight through. Light rays that hit away from the center are bent towards the center. They're going to be bent towards the middle of this pupil. The light rays then hit your lens, and then they're going to bend again. And in normal vision, the image is focused directly onto your retina. Hyperopia is, or farsightedness, means close vision is blurred. So objects are focused behind the retina instead of on it. So hyper means beyond, and then opia means sight. Myopia or nearsightedness means that far vision is blurred. Objects are focused in front of the retina. So myope means to blink. And then we have opia, which means sight. One ope is removed to allow the term to flow. Treatment for hyperopia and myopia is prescription lenses. Presbyopia is a difficulty in nearsighted vision occurring in middle to old age. This is normal aging process. So our combining form of presbyo means old age, and then opia means sight. Presbyopia, you can use convex, bifocal, or transitional lenses. And then an astigmatism. An astigmatism is an unusual or an unequal curvature of the cornea that causes unequal focusing and blurred images. That means without. Stigmat means focus, and that ism means process. What types of visions can be corrected by LASIK? Well, we can correct LASIK, hyperopia, myopia, and an astigmatism with LASIK procedures. So let's look at these words here. We have, I'm going to use same colors here, opia, ism, and ation are suffixes. Opia is going to mean sight. Ism means action, and ation means process. Hyper is a prefix. So that means something different. So let's look at the different disorders of the eye here. Conjunctivitis, which we already talked about, was that inflammation of the lining of the eyelid, are known as pink eye. Conjunctivitis can be caused by allergens, bacteria, viruses, pollutants, and blocked tear ducts in an infant. A corneal abrasion is going to be a scrape of the cornea. Scleritis is the inflammation of the sclera. Scleritis is often associated with rheumatoid arthritis and Crohn's disease. Glaucoma is a buildup of that aqueous humor, that fluid in the front of the eye, in those chambers of the eye, that front chamber. And this picture here kind of demonstrates the vision of a patient with glaucoma may experience. Peripheral vision is lost first. So everything outside of this picture here, they lose, they can't see. Treatment for glaucoma is usually eye drops to help lower the pressure in the eye, because as that fluid builds up, it creates pressure on that eye. Cataracts. Cataracts is caused by, well, it is clouding of the lens. Age can cause it, diabetes can cause it, and smoking can cause it. Cataracts is technically Latin for breaking down or breakdown. It usually starts in the periphery or in the center of the lens, one or the other. Patients with cataracts are going to experience that blurred vision. So all three, what do these words have in common? Foreign bodies and badly fitting contact lenses are both capable of causing corneal abrasions, which is an irritated, scraped section of that corneal tissue. They use the stain fluorescein to help diagnose corneal abrasions. It kind of lights them up. Macular degeneration. Visual acuity is lost with macular degeneration. So a dark, blurry area of vision loss occurs in the center of that vision field. There is no cure for macular degeneration. Retinal detachment is a separation of the retina from the underlying choroid layer. A classic sign is seeing a shadow invading the peripheral vision. Retinal detachments can be corrected by, they are a surgical emergency, and surgery is required to reattach that retina. People have described it as the curtain being closed over their eye. It feels like something is being pulled over their eye. Diabetic retinopathy. Holes are seen in the visual field. So some areas are clear and some are blacked out. Some may appear blurred. An ophthalmoscope examination and fluorescein angiography can help to diagnose diabetic retinopathy. These people usually need laser photocoagulation to help treat diabetic retinopathy. Retinoblastoma, sorry, I added an A, is the most common cancer in children and is diagnosed around 18 months of age. Night blindness is the inability to see poor in light. That inability to see well in light. Night blindness is where you can't see well at night. A lot of times night blindness has to do with a vitamin A deficiency. I mean, it's not the only cause, but if you're not getting enough vitamin A, it can cause night blindness. That's a better way to put it. So let's look at some of these words here. That scopy means to view or examine. Retin means retina. Blast means immature cell, like in retinoblastoma. Then pathy is going to mean disease. So diagnostic, therapeutic, and pharmacological for the eye. Well, one of the main ones, as long as you've been to an eye doctor, you have done this. This chart is known as the Snellen chart. This Snellen letter chart is used to determine distance vision. So this is a chart that sits at about 20 feet away from you. And depending on what line you read, in this far column, it's going to tell you where your vision is at 20 feet. So that top number is always going to be 20. That bottom number is going to tell us where the rest of it is, where your vision is compared to that. We also have a Jaeger reading card. This is used for near vision. These reading cards are cards with different sizes of print on them. So the cards are read at arm's length. Then we have color vision, where we're testing for color blindness. Color vision test is used with the Ishera color system. So you go through and try to read the numbers or the designs on that bottom row on these different pictures to determine color blindness. And then they also do a corneal examination. They use fluorescent staining to reveal abrasions and ulcers. And then they can also they'll do a pupillary light reaction light test where they shine a pen light into the eyes. And what they're trying to see is that pupil, that black of your eye should get smaller in a pupillary light test. Fluoro specifically means fluorine. Peripher means external boundary. Refracto means bend light. Resin means resin, what I want to say. So fundoscopy. It uses an ophthalmoscope to detect lens opacities, retinal changes, and retinal vascular changes. A slit lamp examination focuses the height and width of a beam of light to give a stereoscopic view of the internal structures of the eyeball. It is used for identifying corneal foreign bodies and abrasions and identify retinal diseases. Intraocular pressure is measured with a tonometer. It determines the eyeball's resistance to tension or indentation. Photocoagulation therapy is used to reattach a torn or detached portion of the retina and to prevent further growth of abnormal blood vessels that can cause detachment. High-intensity, narrowly focused beam of light from the agar lens is absorbed by pigment in those retinal cells and converted into heat, which welds the edge of the retinal detachment against the underlying choroid. Retinocryopexy or cryotherapy uses intense cold to have the same effects as the heat of photocoagulation. When cataracts is interfering with vision, the opaque lens is removed by phacoemulsification, in which ultrasonic waves fragment the cataracts to make its removal much easier. The lens is then replaced with an artificial intraocular lens, which becomes a permanent part of the eye. Then we have laser corneal surgery. This is a procedure that uses a laser to reshape the surface of the eye to change the curvature of the cornea. The surgical procedure, radial keratotomy, is used to treat myopia. So radical cuts, like the spokes of a wheel, flatten the cornea and enable it to refract light rays to focus on the retina. Refractive surgery and laser-assisted in situ keratomyelias, or LASIK, can correct myopia and an astigmatism, and alter the outer edges of the cornea to correct hypermetropia or farsightedness. Photorefractive keratotomia generates spoke-like incisions in the cornea to flatten its surface and correct nearsightedness. Trabeculoplasty changes the eye's drainage system by laser beam to enable the aqueous humor fluid to drain out more easily into the bloodstream. Trabeculectomy is the most common traditional surgical procedure in which a passage is created in the sclera to allow excess fluid to drain out of the eye. Keratoplasty is a procedure in which the cornea is obtained from a deceased donor and transplanted or grafted. Coag is going to mean clot. Fundo means fundus. Cryo means cold. Trabecule means the eyes. Fluid drainage system. And carat means cornea. Mydriatics are drugs that cause the pupil to dilate and are mainly used to examine the eye fundus, so that back of the eye. Miotics are drugs that constrict the pupil, miosis. Ocular topical anesthetics temporarily block nerve conduction in the conjunctiva and cornea. They have a quick onset of 10 to 20 seconds and last for 10 to 20 minutes. They are used to assist with eye examinations and visual acuity tests, and to help treat chemical burns, welding flash, and foreign bodies. Ocular diagnostic drops stain that conjunctival cells to improve diagnostic capabilities. For example, the presence of foreign body or corneal abrasions. Ocular lubricant drops are used to replace tears to treat dry eyes, moisten hard contact lenses, and protect the eyes during eye surgical procedures. Help treat keratitis, like Visine, Refresh Optive, Retain. Anti-infective eye medications, both drops and ointments, can be antibacterial and sulfatamide, antifungal, and antiviral. Anti-inflammatory eye medications are used in allergic disorders to prevent scarring and visual loss and inflammation of the eye, and to decrease post-operative eye inflammation and scarring, like corticosteroids. The ear and hearing. So let's look at the ear. The ear is made up of the external, the middle, and the inner ear. That external ear is that external auditory canal, which is going to connect that outer ear to the middle ear with that tympanic membrane, or eardrum. In the middle ear, we have three teeny tiny bones that are called the malleus, the incus, and the stapes that turns any sounds into waves with that tympanic membrane and vibrating of those three little bones that are then going to connect to the inner ear where sound is processed in the cochlea, or where we use balance and equilibrium. We have the semicircular canals over here. We have the vestibule in here. Those are where we do our balance and equilibrium. We are able to examine the external auditory canal with an otoscope. So all of these words share the same root, odo, that means ear. Otologist is a medical specialist in diseases of the ear. Otology is that study of the function and diseases of the ear. Otorhinolaryngologist helps to break some of these down into smaller words. Ear, nose, throat specialist. Rhino is nose, throat, and then this is somebody who specializes. So when you look into that external ear, this is kind of what you see in that external auditory canal. But the actual part of your ear that hangs off of your head is known as the auricle or the pinna. We have glands in our ears that are going to secrete out cerumen or earwax. What this does is it helps the ear canal be protected from foreign objects. It also kind of helps to block off some of that sound sometimes if you're someplace extremely loud. An otoscope is used to view inside of that ear. If there's an infection in this outer ear canal, it's known as otitis externa. Externa, that external ear canal. Otitis is that infection. Oto is ear, itis is that inflammation. So let's look at some of these different Latin words. Ear, auricle. Wax, cerumen. Passage or channel, meatus. Wing is pinna. These are the actual Latin words for these more common terms. So here is that tympanic membrane, also known as the eardrum. In the middle ear, we also have what is known as the eustachian tube. That eustachian tube connects that middle ear to that nasopharynx, so the backside of the ear. The eustachian tube is fully developed around the age of 5. So children under the age of 5 are very susceptible to middle ear infections because that eustachian tube lays more horizontal. So bacteria can climb up it really easily. Inflammatory fluids don't drain out of that middle ear as well. In an adult, that eustachian tube is more angled, so it's a lot harder to make its way up into there. So those middle ear ossicles or bones. We have the malleus, the incus, and the stapes. They are supposedly named for the shape. The smallest bone is the stapes, and the 3 bones are helping to transmit sound by vibration. They can even amplify sounds, so you can hear things super quiet. And this is where some of these words are getting their terms from. So let's look. Incus means anvil. Somebody thought the incus looked like an anvil. Malleus means hammer. So malleus kind of looks like a hammer, and that stapes looks like a stirrup. And that's exactly how the names came about. Ossicle means small bone. Tonsil means exactly that, tonsil. So acute otitis media is the presence of pus in the middle ear with a fever, pain, and redness of that tympanic membrane. Excuse me. In little kids, you usually see them pulling on their ear because it hurts. In chronic otitis media, the infection usually subsides, but the eustachian tube remains blocked. And the effusion, or that fluid in the middle ear, cannot drain out. This is where tubes get inserted into that tympanic membrane to help drain everything out. Cholestadiomas occur in chronic otitis media. They are chronically inflamed cells that have developed into a tumor. Otosclerosis occurs when spongy bone forms around the junction and the oval window and stapes, preventing that stapes from conducting sound into that inner ear. Acute otitis media can actually result in a ruptured tympanic membrane. AOM, acute otitis media. BOM, bilateral otitis media. OME, otitis media with effusion. PE tube is pressure equalization tube. And then URI is a upper respiratory infection, which in kids under 5 can lead to that acute otitis media. So in the inner ear is made up of a series of pathways. The cochlea contains receptors to transmit vibrations into nerves so that the brain can interpret them as different sounds. The labyrinth is complex, intricate system of passages where the cochlea, semicircular canals, and vestibule reside. The vestibulocochlear nerve is what transmits those sounds. It's that cochlear portion, also sometimes called the auditory nerve. Conductive hearing loss could be from impacted cerumen. Infected external canal, foreign bodies in that external canal, or middle ear pathology. Sensory neural hearing loss could be caused by damage to those fine little hairs in the cochlea by repeated loud sounds. Examples include work-related jackhammers, leaf blowers, leisure-related exposure like amplified music. People who, if you can hear somebody's earbuds or headphones clear as day standing right next to them, their music's too loud. They're damaging their hearing. So conductive hearing loss, as we just mentioned, was that impacted cerumen, infected external canal, foreign body in the external canal and middle ear pathology. Sensory neural hearing loss can be from those fine hairs damaged from loud sounds. The cochlea actually means snail shell. Implant means to plant. Conduction means to lead, and vestibule means entrance. So the organs of balance is the vestibule and the semicircular canals. Rotational movement is picked up by the crista ampullaris. Vertigo is a sensation of spinning or whirling. It's Latin for dizziness. Tinnitus is that ringing in the ears. Tinnitus is Latin for jingle. So that vertigo is that spinning or whirling sensation. Tinnitus is that ringing in the ears. Benign paroxysmal positional vertigo. There we go. BPPV, as it's also known as, is a type of intermittent vertigo caused by those otoliths or little stones in your ears in the vestibule migrating into the semicircular canals. So equilibrium. Librium gonna mean otolith. We have oto, which means ear. Paroxysmal. Paroxysm is gonna mean irritation. Okay, let's look at diagnostic and therapeutic procedures for the ear. Let's look. So there's different types of hearing tests we can do. We can do a whisper test where you stand next to somebody, you whisper in their ear, see if they can hear it. You get a little bit further away, you whisper in their ear again. So you see how far away it is till they can't hear it anymore. Weber test. Weber test, you use a tuning fork. You place it in the middle of their forehead. And if one side is louder than the other, that usually signifies some sort of hearing issues. If both sides are the same, then hearing is normal. Rhine's test you do if there is an abnormality in Weber's test. If one side is heard louder than the other, then you take that same tuning fork and you put it on the mastoid process behind the ear and you listen to that sound. And once that sound, you can't hear it anymore, you put it right next to the ear. And you use that to work to figure out normal hearing occurs when the patient can still hear the sound from the pinna. So if not, it indicates conductive hearing loss. There's also an audiometer. Is an electronic device that generates sound in different frequencies and intensities and can print out the patient's response. There's also that otoscopies. So you can examine the external and middle ear. So a pneumonic otoscope pushes air into the ear to see if the eardrum moves freely. An electrocochleography measures the response to sound by the nervous system. A soft electrode is placed deeply into the external ear canal and other electrodes are placed on the forehead to measure the response sounds. Auditory brainstem response test also measures the nervous system's response to sounds with a setup and procedure similar to an ECOG. This test, ECOG, this one is also known as that ABR, that MRI, that magnetic resonance imaging. The structures of the inner ear can be helpful in the diagnosis of some vestibular disorders. And also those CT scans, those computerized axial tomography can help diagnose problems in and around the inner ear. We can do ear cleaning, which helps to equalize the pressure in the middle ear with the outside air pressure by making the ears pop, or ear clearing. It can be performed by yawning, swallowing, or using a method like a Valsalva maneuver. Valsalva maneuver is where you kind of bow down for or bear down for a bowel movement, is what this should be an R. Pick a different color. R, not an N. And except you're not actually moving a bowel movement, but it's creating enough pressure inside of the body that it causes your ears to pop. Where you can pinch your nose, the mouth is closed, and you can attempt to make a breath through the nose. That'll also pop your ears. Earwax blockage removal is removed by loosening it with oil and then flushing, curating, or suctioning out the softened wax. Debridement is the removal of necrotic tissue and debris from the external ear canal and otitis externa using dry cotton wipes and or suctions. And then for moderate infections, they sometimes require a topical antibacterial suspension that you put into the ears. Chronic otitis media with effusion, when the sticky fluid persists in that middle ear, a myringotomy can be performed, and a small hollow plastic tube is inserted through the tympanic membrane to allow the effusion to drain out. These tubes are called tympanostomy tubes, or pressure equalization tubes, PE tubes. Hearing aids can help with sensory neural hearing loss, and an audiologist will recommend the type of device for each patient. And then there's cochlear implants, which can be used in severe hearing loss. So let's look at some words here. In curettage, cure means to cleanse. Debridement, bride, means rubbish. Necrosis, necro, means death. And irrigation, irrig, means water. So between the eye and the ear, there's a lot of different structures that are helping us hear and helping us with vision. There's accessory structures that help along the way. And then there's lots of different kinds of treatments that can help patients with their different types of treatment. Thank you very much for listening. Have a good day. Bye.